Chris Hipkins exposed. He joins the New Zealand Fraudster scam list. The success of Hipkins Medicard 3 free GP visits depends far more on whether New Zealand can keep and also attract enough doctors than on the capital gains tax he intends to hit mum and dad property investors with to fund the Labour Party's freebie gimmick. The medical workforce is a critical foundation because without it, even the best funded policy cannot deliver the healthcare people need and expect. Labour's Horror Healthcare 2027. Imagine the Labour Green Alliance somehow managed to win the November 2026 election. I know, horror story, but just imagine this horror healthcare story for 2027 onwards as follows. The doctor shortage overwhelms the system. The Hipkins Medicare 3 free GP visits, New Zealand Labour Party's creme de la creme vote baiting policy, will crumble because the workforce will collapse faster than it can be replaced. That's a no-brainer at the moment. Several highly likely pressures will combine to totally stuff up Labour's healthcare for Kiwis. Many investors stop selling properties, so capital gains tax revenue drops sharply. The free GP visits create a surge in demand, increasing queues and wait times, and, most damagingly, the GP workforce shrinks further and faster than expected. The system becomes overwhelmed, and even though GP visits are free, people cannot get appointments. Waiting times blow out, clinics become overloaded, and the remaining doctors face even more pressure, which causes even more healthcare workers to leave. Let's dive deeper. Here's what's very likely to happen should Labour win the election. Many property investors will change their behaviour to avoid paying the new capital gains tax. Many landlords will stop selling their properties. Some will pass properties down to their children instead of selling. Others will refinance the properties rather than cashing out. This lock-in effect is well documented overseas, which will reduce taxable property sales by a significant 40 to 60%. Should that actually happen, and it's likely to happen, then the tax revenue would fall to $150 to $300 million a year, which is significantly below Labour's expectations and also significantly below what is necessary to fund the 3 free GP visits. A Labour Party win would be a healthcare doomsday. At the same time, free GP visits would trigger a big jump in demand. People who previously avoided the doctor because of cost now book appointments freely. Some go more often than they truly need to. Others seek care earlier, which is good for health, but increases workload. If New Zealand also continues losing doctors through retirement, burnout or migration, the system becomes even more strained. Immigration may help, but if it doesn't keep up, clinics will simply be unable to meet the surge in demand. Waiting times grow, doctors burn out, and the system becomes clogged. But wait, it gets worse. Even with workforce limits, the government still ends up paying more for visits than before. Costs could rise to $480 to $680 million per year. Now the gap becomes clear. With revenue falling and costs rising, the policy could run a deficit of $150 to $500 million annually. That shortfall would need to be covered from elsewhere, either from the health budget itself or by implementing other taxes, which many commentators have predicted will happen. The Chris Hipkins Labour Party's scam. The doctor shortage is a real bottleneck in the free GP visits policy. When people talk about Labour's plan to fund free GP visits using a capital gains tax on their investment properties, most of the debate focuses on the money. Will the tax bring in enough? Will the visits cost too much? Will investor behaviour change? But there's a much bigger issue hiding behind the financial arguments. This is, New Zealand simply does not have enough doctors, and this shortage is already shaping the future of the health system more than any tax policy ever will. Conclusion. The success or failure of the free GP visits policy will be determined not by spreadsheets, but by people. The doctors who stay, the doctors who leave, and the doctors who choose whether or not to come to New Zealand. Until the workforce shortage is addressed, any policy that increases demand will run into the same wall. There simply aren't enough doctors to go round. Hipkins knows this, the Labour Party knows this, And like the Green Party, they're all just a bunch of scam artists. Hipkins just needs another 18 months as Prime Minister to qualify for a lifetime of gold-plated, no questions asked, taxpayer-funded benefits for himself and wife. What do you think Hipkins cares about most? You or the money? Hipkins is another political scam artist. He's a total and utter fraud, just like Ardern. Thank you for listening. WhangāreiTim.